Right, I'm starting. I told you, I have so much stuff to go over. So, also, they made me submit my presentation about 3-4 weeks ago. I literally have my own computer set up, thank you so much in the back. I have my own computer set up so we can navigate through a bunch of different things. It turns out that the stuff that I thought I would be telling you, I actually think I want to change up a little bit of what I tell you guys. But first and foremost, hi. Hi, my name is Melinda. Let's see, let me just get rid of that. Wait, there you go, there's me. Okay, so that's me. Basically, I founded a company along with my mother in 2012. We are nationally recognized Medicare experts. You'll find us in the Wall Street Journal, Forbes, USA Today, Fortune Magazine, NerdWallet, because we do not sell insurance. So that's why we are in all those publications. It's really hard to find Medicare experts who do not sell insurance and are going to tell it like it is. We are not beholden to insurance companies. Basically, what I want to do to start this out today is I want to do a little stretch. Okay, ready? I want you to take your right hand, reach way up behind you to the left, okay? Then I want you to reach way down to your right and say click. Congratulations, you are now buckled up. I want you to keep your arms and legs inside the vehicle at all times. This can be a dangerous ride. So we are going to learn about Medicare, and I will tell you, I promise you, you can call me many things. One of the things you cannot call me is boring. It won't happen, guarantee it. So we are going to jump into Medicare. There will be no snoozing. So first and foremost, I'm going to go through some of the 4 dirty Medicare secrets, but I may jump out of this. What is going on? Why are we like looping? There we go. All right, so fun fact, dirty secret number 1. It is not easy to enroll in Medicare. I don't think any of you actually thought it was. I know that there's one dude who thinks it is. Medicare for All is really easy, and it's free, and it's single payer, and I have no idea what he's talking about. So none of those things are Medicare. But shocking, it's not easy to get enrolled in Medicare. So ask anybody today about to turn 65. Anybody in the room 65 years of age and older? Well, you didn't have to raise your hand. But you guys know this is not easy, right? You thought that it would be simple until all of a sudden it's your turn, and you're like, what the heck? What happened? How do people do this? I hear it all the time, every day. I am a fill-in-the-blank smart person. I am a brain surgeon, rocket scientist, neurosurgeon, or like brain surgeon and neurosurgeon are the same thing. But we have clients who fill all of those roles. And they tell me the same thing. I am this really smart person. Medicare confuses the heck out of me. How does the average person do it? That's what I hear all the time, day in, day out. So if you ask anybody, 72% of people are going to tell you they do not understand Medicare at all. So what happens is, as they go along, they make mistakes. What the heck? Why do we keep going back? Is that, oh. So the top button's back? That doesn't make any sense. So apparently I'm button challenged. So as we go through Medicare enrollment, people make mistakes. What people don't realize about Medicare mistakes is there is no such thing as a little mistake. Just one little mistake can cost a person thousands of dollars a year for the rest of their lives and even keep them from getting needed health care. That's what Medicare mistakes are. In fact, we took a look at our average client base. We created an average client experience amongst our consulting clients. We extrapolated that number out to the national population. In this way, we've estimated seniors make about $6.4 billion worth of Medicare enrollment mistakes annually. That's annually, not total. It happens each and every year. What the heck am I talking about? Well, because we are forcing seniors to become Medicare experts simply to enroll in the program. They literally spend hours trying to make heads or tails out of this Medicare thing. Now, the government, they're going to try to help. They are going to send every person turning 65 a handy-dandy guide. This handy-dandy guide is called Medicare and You. Anybody seen it? Yeah, this handy dandy guide is 127 pages in length. How many people wanted to sign up for a college course just to get enrolled in Medicare? I didn't think so. So people don't do this. They don't look at it. They maybe get a couple pages in, then they throw it out. All right, so if that's not working, where else are seniors supposed to turn? How about Social Security? Yeah, Social Security's primary mission is Social Security. Their secondary mission is Medicare. Social Security by itself has 2,700 rules with thousands of codicils for those rules. When you call Social Security to get help with Medicare, there's only one phone number. You get who's ever up next in queue regardless of what they know and quite frankly don't know about Medicare. So if the Medicare and U-Book isn't working, Social Security isn't working, where are clients supposed to turn for help? Well, SHIP. Yes, you can turn to SHIP. I'll just be really honest with you. I have a little bit of issues with SHIPs. I've been doing this since 2012, and my mother's a nationally recognized Medicare expert since the 80s. I was fed Medicare at a dining room table growing up. I am still learning things every day. SHIP counselors get 4 weeks of training. You get what you get. Be nice to your volunteers. And also, there's only so many volunteers. There are literally millions and millions and millions of seniors who need help. So try SHIP, be nice. If you get one that isn't the best, give them peace and forgiveness. But other than that, where do you go? So people try all sorts of things. They try to go to their HR professionals. HR professionals do not know Medicare. They do not know Medicare. I have horror stories from companies, national S&P 500 corporations, you know the names of, who were about to put clients in permanent, costly, late enrollment penalty situations, and worse, people with cancer being put in situations where they didn't have any health coverage at all because of what the HR professionals said. So HR professionals do not know what's up. They go to financial professionals, retirement planners. I will tell you that they do not. They consider retirement actually their finish line. So once you hit retirement, they're done. Good luck for the rest of your 20 years. So these are all the people that they turn to, but by and large, what happens is when you turn to somebody you trust, they say, well, that's not really my thing, so good luck. Go somewhere else. They know they can turn to insurance agents, but how many people out here, when you have a used car, do you take your used car to a used car lot and ask the sales agent that comes out how much your car is worth? No, you don't. I'm getting laughter because you know that the sales agent is not necessarily in your best interest. So you are going to do your own research ahead of time. Clients know this. So they're going to try to find out the information that they need to know beforehand. So my job partially here is to get you guys motivated to help clients more about Medicare. And I know you've been doing it. I've never seen so many sessions about Medicare at any conference I've been to. So I'm motivated, but I have to clear up some gaps. So that's what my job is today. So basically, this is what happens for most people. How are they going to tackle Medicare? How are they going to deal with Medicare? They ultimately just wind up throwing darts at a board, and they hope for the best. That's what happens. And a lot of times, hoping for the best does not mean you're going to end up with the best. So that's dirty secret number one. How about dirty secret number two? Marketing tactics of insurance companies actually exacerbate this problem, and I know that's not news to anybody. Thank you, Joe. Thank God Joe's off the air. As of 2023 and regulatory changes, he was pulled off the air. All of those commercials are gone. But he now sells hearing aids, everybody. So marketing tactics lead to big insurance confusion. All right, this is what happens to clients' mailboxes. When they turn 64, I have something called a paper bag strategy. It's a marketing strategy. So if you are trying to target people age 65 years of age and above, pay attention. Here's your new marketing strategy. It's called the paper bag strategy. You send the clients a birthday card at the age of 64. In that birthday card, first, obviously say happy birthday, but then fold up a grocery store paper bag. Hopefully your grocery stores still have some. On that paper bag, you've written, when you 3 months before I turn 65, so-and-so, Susan, Sally, Joe, George, will call me to help me with Medicare. In the meantime, put Medicare marketing materials in here. They are about to get 2 to 3 direct mail pieces a day, starting at 64 and 3 months. You need to prep them for what's about to happen. This is one client's Medicare marketing materials. They keep them. Fun fact, clients keep them because they do not feel comfortable throwing it out. There may be something in there that they need to know, so they develop a stack. They're not throwing it out by putting it in that paper bag. And every single day, they are thanking you. Oh my gosh, thank God I don't have to read this because Sally, George, Pat, Sue have got me. It's a big deal. It's a great way to keep top of mind awareness and to gain clients and new clients, because when friends come over, what's that? Oh my God, that's so cool. I want that person to help me too. All right, so that's the mail. Now, what I need you to do is understand the 3 steps of Medicare enrollment. 3 steps is what most people think Medicare enrollment is. They think, first and foremost, that you begin Medicare enrollment by picking plans. Pick your plans, United Healthcare, Humana, Aetna, Blue Cross, Blue Shield, pick plans. Once you've chosen plans, then you get enrolled in Medicare. Once you have your Medicare card, then you can sign up for those plans you initially chose. Wrong answer. This is Medicare. Of course, it's not 3 steps. It's actually 6 steps. And simply understanding all 6 steps is a huge win for both you and your clients. So I'm going to teach you all 6 steps. And actually, there is a handout called the 6 steps, the Road to Medicare, 6 steps of Medicare enrollment. I don't have a ton, but if you happen to have one next to you, congratulations, winner, winner, chicken dinner. All right, so here are the 6 steps. The first step of Medicare enrollment is not picking plans. Good Lord, that's what the insurance companies want you to think. The first step of Medicare enrollment is timing. Do you enroll in Medicare at age 65 or do you delay? It is all based on a client's unique situation. Now, I get it. We all want silver magic bullets for this stuff. So you will hear, everybody has to. Everybody has to get enrolled in Medicare when they turn 65, Melinda. Everybody has to get enrolled in Part A when they turn 65, Melinda. Everybody who's still working doesn't need to do anything related to Medicare, Melinda. I'm going to teach you the golden rule. Oh, sorry. I'm going to teach you the golden rule, but first I'm going to teach you this. The factors that impact timing are actually 5. Whether or not you're receiving Social Security benefits, the employer size, the employment status, HSA status. HSA is health savings accounts. Health savings accounts are the only retirement fund where the money goes in tax-free, it grows tax-free, and comes out tax-free. Sorry, don't forget your 401k, but max your HSA first. The number 1 cost in retirement is what? Healthcare. You will have plenty of opportunity to spend out your HSAs. It's the only one where the money goes in tax-free, grows tax-free, comes out tax-free. If you are making contributions to a health savings account and enroll in any part of Medicare, you can no longer make contributions to a health savings account. So it's a factor related to timing. So Social Security benefits, whether or not you're receiving them, employment status, whether you're actively working or not, fun fact, HR professionals stink at this step. They will create severance packages that include paid COBRA coverage for 10, 12 months. What they won't tell you is that COBRA coverage will not work at all once employment stops. As soon as employer-provided coverage is no longer related to active employment, it becomes secondary to Medicare, regardless of whether you enroll in Medicare or not. I've had 2 cancer patients in the last 3 years given a severance package with paid COBRA coverage, but no functional health coverage because of what the HR professionals said. As soon as employer-provided coverage is no longer related to active employment, I don't care what the HR department says, it becomes secondary to Medicare. Severance packages, retiree coverage, COBRA coverage, all secondary to Medicare. Get enrolled in Medicare right away, or you effectively do not have health coverage. So employment status is a big one. Employer size. Greater than 20 employees, 20 or greater, sorry, let's say it right, 20 or greater employees, you can delay Part A enrollment and Part B enrollment. Okay, you can delay it. Under 20 employees, that coverage will become secondary to Medicare. Again, whether you enroll in Medicare or not. Now, there are some what I call Bigfoot cases, where you can actually see Bigfoot. There are some cases in which the coverage will pay primary, even for small employers, but get it in writing. Because by law, that's not the primary and secondary payer laws. So you need it in writing from an enforceable source. Somebody higher up that says they will pay, because by law, they do not have to, and they can change their mind. Get it in writing. Then HSA status, if you're making contributions and want to continue contributions and all the other things work, you don't have to get enrolled in Medicare. And ultimately, the cost and the quality of the health coverage, because just because you don't have to get enrolled in Medicare doesn't mean that it's not in your best interest. Employer coverage is getting stinky. Stinky, it's a technical term. So if your coverage is stinky, maybe it's more cost effective and you'll get better coverage by fully moving to Medicare. So those are the 5 factors, and they're unique to everybody. So here's what I mean. When it comes to Medicare, there's only one golden rule, and it's this. The only thing in Medicare that is true for everyone is nothing in Medicare is true for everyone. Okay, so whenever you hear everybody has to, and I've actually heard that around this conference, turn around and walk away. Even the initial enrollment period. How many people know the initial enrollment period? The initial enrollment period is the 7-month period surrounding your birth month. It is your chance to sign up for Medicare, your first chance. It begins 3 months before your birth month, includes your birth month, and ends 3 months after your birth month, unless your birthday's on the 1st of the month. Then it's 4 months before your birth month, includes your birth month, and ends 2 months after your birth month. People, we can't make this stuff up. It is insane. So the only thing in Medicare that is true for everyone is nothing in Medicare is true for everyone. I know we want silver bullets. Silver bullets hurt people. I'm surprised at that. Wow. Yeah, that's very profound, Melinda. Dang. Okay. So I don't know what's going to come out of my mouth half the time. So timing is the first step. Then step 2 is choosing a Medicare path. And by path, I technically mean type of coverage. So there's a few different things that you can potentially choose. There's 5 paths. Original Medicare with a Medigap policy, also known as a Medicare supplement. Supplement, Medigap supplement, same thing, interchangeable. It's not a Medicare Advantage plan. Please do not call a Medicare Advantage plan a supplement plan. It confuses the heck out of people. Okay, it's 2 very different things. So, original Medicare with a Medigap policy, Medicare Advantage, retiree coverage, military coverage, or federal employee health benefits. Fun fact, I've had 2 clients with all 5 path options. So people can have many path options. The goal is to pick the path that is in your best interest. When you choose a path, you may never be able to change that path later in life. That's why we use the term path. I want people imagining themselves at a fork in the road. Once they make that decision and start walking in that direction, that path may never cross again with the path that went this way. So the path can become permanent. So timing and then path. Once we know those, and see, by the way, this is the path landscape. If I need to go into this more, I absolutely can. So I'm going to jump down here. This is why I need to be mobile. Okay, so the path of original Medicare, okay? It includes Medicare Part A, hospital coverage. Okay? Medicare Part B, medical coverage. Hospital, medical. Medigap policy is the supplement, Medigap supplement, and it includes a standalone Part D drug plan. Part D drug plans are always provided by a private insurance company. There is no such thing as a government Part D drug plan. You choose the plan that's in your best interest. Do not pick a plan with zero premium just because you think the $2,000 spending cap. No, please God, no. I'll get there. Okay, so the Medigap policy, fun fact, the Medigap policy is not health insurance. It's not health insurance. The government building. The government is your health insurance on the path of original Medicare. The government decides what services you get. If there's any prior authorization, for the most part, there isn't. The government is your health insurer who decides what is covered and what is not. The Medigap policy has one job: to cover the costs that Medicare Part A and Part B would have left you paying. A Medigap policy is cost insurance, not health insurance, okay? Cost insurance, not health insurance. Medicare Advantage, totally different path. Notice there's a corporate building in the background, not the Capitol building. When you choose Medicare Advantage, you give up the government's version of Medicare. You may have a Medicare card with Part A and Part B on it. You get no hospital services or medical services through the government on Medicare Advantage. The reason you have to be enrolled in the government's version of Part A and Part B is so that the monies get transferred to the insurance company. You're paying $174.70 each month for Medicare Part B per person, potentially some income adjustments. There's a certain amount of money with your name on it in the Medicare Trust Fund. You have to be enrolled in the government's version of Part A and Part B, so those monies go to the insurance company. The insurance company's goal is to keep as much of that money as they can. So the rules that you follow to get hospital and medical coverage are very different. The reason that this matters so much is because as soon as you choose your path, bada bing, bada boom, I'm too far away. An earthquake happens. Now if you decide you don't like the path that you're on, well, you can't just willy-nilly cross, you fall into the chasm. So you wait for open enrollment. But open enrollment doesn't guarantee much of anything because there are rules to crossing on that open enrollment bridge. If you start on the path of original Medicare with a Medigap policy and want to change to the path of Medicare Advantage, bada bing, bada boom, head right there. Medicare Advantage will be waiting for you, open arms. More money for them. If you are on the path of Medicare Advantage and want to head to the path of original Medicare, there is a lovely thing called guaranteed issue right. You have a guaranteed issue right to get the Medigap policy, cost insurance. For the first 6 months, you are 65 years of age or older and enrolled in Medicare Part B. After that, you may never be able to get a Medigap policy again in your life. Fun fact, you may never be able to change that Medigap policy. There are 36 states, 37 states in this country where to change a Medigap policy, you have to go through medical underwriting. So the Medigap policy you choose, initially, you are marrying. It is not a matter of picking a policy that's the cheapest. You may have heard Plan G, Plan F, Plan K. I love it. You have Part A, Part B, Part D. And then you add a Plan G is greatest. Plan G is greatest. If you can't afford a Plan G, try Plan N next. Or if you live in New York, N for New York. Don't get a G in New York. It's ridiculously expensive. So, to get those Medigap policies, though, you'll have to go through medical underwriting. If you have any chronic conditions, any histories of surgeries or needs, chances are dang good, bye-bye, gone. You can go Part A and Part B by itself, but then you pay 20% of everything with no spending limit in sight. Because contrary to what Bernie tells you, Medicare is not free. So, definitely not free. I'm gonna fall over, it's great. All right, so which type of path do you think insurance companies like to sell? Medicare Advantage. I'm so glad you guys all know that. So Medicare Advantage open enrollment, and there were almost 650,000 commercials touting these amazing things, free dental, free vision. They're all gone now, thank God. But this is why. When you look at all types of health insurance, group coverage, Medicaid, Obamacare, healthcare marketplace plans, on average, the insurance companies make about $700, $750 in profits per member per year. Medicare Advantage, they make more than $1,700. You tell me, what? Right there. So, healthcare marketplace plan, employer group health plan, Medicaid plans. Per member per year, they make about $750 a year. Medicare Advantage, they make more than $1,700. So, and by the way, for every dollar that we spend providing care to a client on original Medicare, we are paying $1.23 for that care on Medicare Advantage as taxpayers. So this idea that Medicare Advantage is saving us money, that's hilarious. So insurance agent commissions. Now, technically I should update this, but the orange is Medicare Advantage commissions. This is the initial sale. So if I'm a Medicare agent, technically, if I sell you a Medicare Advantage policy right now, I get a commission of about $690. If I sell you a Medigap policy, I get 20% of the commission over the first year, or the premium of the first year. So it averages about $360. I want to sell you Medicare Advantage, but this puts the nail in the coffin. There are residuals. Medigap policies stop paying commissions after 6 years. Medicare Advantage policies never stop paying commissions. So what do you think they want to sell? And it's a lot easier to sell $0 in monthly premiums and free dental coverage. Why wouldn't you get this amazing plan? Well, and as a result, this is what we see. Year over year over year, we are now up to 53% of all Medicare participants are enrolled in Medicare Advantage. And it's a sales model. It's totally the sales model. And it's projected to be 62% by 2033. So, anyways, good God, I have 3 minutes. Oh God, I gotta wait, hold on. I have to do this. I'm sorry. I'm leaving so many good things on the table, but I have to do this because you guys need to know this. So the biggest news right now is the $2,000 spending limit, and we've heard this several times. Ultimately, what's happening is there used to be 4 payment stages that a person would go through in a year: the deductible, the initial coverage phase, the coverage gap phase, and a catastrophic coverage phase. In each phase, the drug would cost a different price. What happened in 2024, essentially, is there's no more catastrophic coverage. Seniors used to have to pay 5% after they got out of the coverage gap. 5% of the retail cost of medication can be pretty dang expensive, but that's gone. Now, come 2025, there will be no more coverage gap. These segments are split by the amount spent by the consumer in each pill stage. Notice most of the pill is gone. So consumers now ultimately are going to be spending very little. They'll be done paying. But that does not mean the medications are free. That does not mean that the medications became free. Who is paying for these medications? That's the question we need to ask that really we're not asking. So who's paying for the medications? In 2023, again, the seniors would pay 5% after about $7,000. Medicare would pick up 80%, and then the Part D insurance companies would pick up 15%. Come 2025, dig this. We're expecting Part D insurance companies to pick up 60% of the cost after a $2,000 spending limit. People, this is the equivalent of a billion dollar hit. $1 billion. How many people think a Part D insurance company is going to take billions of dollars in hits? Wow, not a single hand, I'm shocked. Okay. How are they passing on the cost? We've already seen this between 2023 and 2024. This is a template they've already developed. Number one, they are going to be increasing premiums. Premiums. So overall, premiums are increasing 25%. Ignore the premium capping. That's a technical bull honky. Premiums can absolutely increase 25 to 50%. It's technical mumbo jumbo that Medicare pulls, that the overall plans can only increase by as much as 6%. So technical mumbo jumbo, you will see plans increase 25 to 50%. Next, increased cost sharing for all. So if you used to have a $0 copay, expect a $3 copay. If you used to have a $5 copay, expect a $10 copay. That's not that big of a deal. But when the copay becomes a co-insurance, now we're talking a bigger deal. So we've got flat amounts changing to percentages. Imagine you have a client with Eliquis. Eliquis has a retail price of about $550. If your $47 copay becomes a 25% co-insurance, you are now paying $137 per refill for that prescription. All right? They can do these things. But this isn't even really what I'm concerned about. What I'm concerned about, and the game changer, the ball game, is this. Dropping medications from the Part D formulary altogether. The $2,000 spending limit only applies when the medications are covered by the Part D drug plan. They don't have to cover all medications. The rule literally is they have to cover at least 2 medications in the most commonly prescribed categories. 2 means 2. Most commonly prescribed categories is not all categories. We saw this. We saw 70% of drug plans not covering 5 to 7 of the most common 10 insulins in 2024. People, you got to review your coverage during open enrollment. It is the game. Forget smoothing. Smoothing is the celebration that happens in the locker room after the game. We need to be on the field during the game. But with a headline like $2,000 out-of-pocket spending limit, we only have 3 out of 10 people participating in open enrollment any given year. That's going to go down because they think now the most I'll be seeing is $2,000. Right? Why suffer through the headache and the heartache? It only applies when the medications are covered. And I need to tell you this. So I have a client who has stage 4 cancer. She's surviving on a medication called Tagrisso. In 2023, 16 out of 22 drug plans included Tagrisso. Okay? In 2024, 2 plans out of 22 included Tagrisso. What do we think is going to happen in 2025? The retail cost of Tagrisso is $32,000 a month. Tagrisso is the only thing keeping her alive. She's used other medications before. This is her life-saving drug. She can't switch to another one, expect the same results. The game is open enrollment. Smoothing is nice, and we'll figure it out. But if the medication's not covered, there is no smoothing. Okay, please, 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 please help your clients. I can talk to you about, there is SHIP. You can have SHIP. Pharmacies can do it. Pharmacies will only cover the costs at their pharmacy. You can save thousands of dollars by changing pharmacies. Pharmacies will do it, but check other pharmacy costs. You can use the Medicare.gov Plan Finder tool. If you're using the Plan Finder tool, it's not about the monthly premium. It is not about the deductible. It is all about the total out-of-pocket cost. The reason we have a Part D drug plan is to get our prescriptions. If the prescription's not covered and it has a $0 premium, who cares? So check the total out-of-pocket cost. So, and then there's also places like me. We have a new service because open enrollment is so important this year. It's called Hey Mo Medicare Open Enrollment. It's a reminder and review service. We do not sell insurance. We charge a fee. It's a $30 fee to do it. I get it. Some people can do it, some people can't, but it's an option. It will proactively send you a text and tell you, you'll save $500 by changing drug plans. Do you want to? And they don't have to do it themselves. So if you're interested, you absolutely can look at it, but there's no pressure. So we're all advocates, and we're doing the best we can. I will be available for questions. I'm sorry I went over.